Welcome to Doctors on Call. I'm Jenna Miller. Seeing your dentist twice a year may include more than just x-rays, fillings, and dental cleanings. Airway health, sleep apnea, and TMJ disorders may all stem from oral dysfunction. Improved breathing, better sleep quality, and jaw function can be bettered through customized oral appliances, airway-focused therapies, and TMJ solutions to relieve jaw pain, headaches, and tension. On tonight's Doctors on Call, we'll be discussing dental health and much more with our guests, Dr. Paul Jones and Dr. Courtney Kaba from Cedar Lodge Dental Group in Hayes.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Regional Hospital, experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Welcome back to Doctors on Call. I'm Jenna Miller. Dr. Paul Jones grew up in La Crosse, Kansas. He graduated from Kansas State University, earning his degree in milling science and management. He graduated from the University of Missouri Kansas City School of Dentistry in 2007. Since earning his degree, Dr. Jones has attended numerous courses in advanced general dentistry, implantology, orthodontics, oral surgery, and endodontics. Dr. Jones is also involved with the latest advances in aesthetic, implant, and restorative dentistry. He has earned his IV sedation permit and is certified in advanced cardiac life support. Dr. Jones and his wife Stephanie have 4 children and are owners of Cedar Lodge Dental Group in Hayes. Dr. Courtney Kaba is a Hayes native. Directly following graduation from Fort Hays State, she attended and graduated from the University of Missouri Kansas City Doctor of Dental Surgery program. Following graduation, Dr. Kaba practiced as an associate dentist at a ski resort town in Colorado and continued her education with the Spear Education Center. This has allowed Dr. Kaba to further her knowledge on endodontics, oral surgery, implants, sleep apnea, full mouth rehabilitation, and more. Dr. Kaba moved back to Hayes in 2022 with her husband Nick and is currently a practitioner at Cedar Lodge Dental Group. Doctors on Call brings you information which may be useful to you when you see your own physician or dentist. While we wait on those first calls to come in, we're going to go ahead and jump in and get started with the show. Thank you both so much for joining us tonight.
Thanks
First
for
of all,
having us.
absolutely. First of all, let's talk about how your practice assists with airway health.
Well, you see, nothing matters but taking the next breath. And the whole respiratory complex starts right here. And if this is not adequate to pull air in and fill the lungs, then we've got problems already. And so one of the main things that we're looking at is craniofacial growth and development. We're looking at undersized jaws, and some of the symptoms of that might be crowded teeth, might be an open mouth breathing posture, could be an open bite. We're also assessing lip ties, tongue ties. All of these things are soft tissue dysfunction that drives craniofacial deficiencies. So.
Absolutely. So let's dive in a little deeper and let's discuss the treatments you offer that improve sleep quality and jaw function.
So in our office, we do a lot of work with tongue and lip ties, starting with infants and going all the way up to adults. And so this is something that I'm fairly passionate about because it's something that has affected me in my everyday life. Growing up, I had a tongue restriction, and I actually had no clue that I had one until I went and I did the continuing education on it. And so when the tongue falls back in the airway because it doesn't have any room to set and rest in the roof of the mouth, then it causes open mouth breathing, snoring, and just a lot of sleep apnea issues. And so as an adult, oftentimes if these things aren't addressed, you might be on a CPAP, just have poor quality of sleep. And so that's something that we really focus on in the office is tongue and lip tie restrictions, as well as doing any sort of expansion of the top and bottom jaws to allow room for the tongue to rest where it needs to.
Absolutely. And we're hearing a lot about the tongue and lip ties. I feel like it's more commonly heard of, not that it's more common, but
Yeah.
So How soon do you know that a human being has a tongue or lip tie?
Yeah. Usually, I mean, within the first few days after birth. When a mom is nursing, they would be able to start being able to tell. So if, milk is leaking out when nursing, whether that's bottle feeding or breastfeeding, that's usually an indicator. If the infant had hiccups a lot in utero, that's another sign that they may have a tongue restriction that was, not diagnosed quite yet. You want to take over on a few of those?
Yeah, even popping and clicking, sliding on and off the breast, painful nursing. There's numerous things that can indicate that they have a tongue and lip tie. And we've released infants as young as 1 day old to fully grown adults. So it just depends. Not all tongue ties are symptomatic. Somebody may have one that you can actually see it, but they've been able to overcome that. And so we don't release everything that has a tie. We want to be objective about it, collect the data, and then, make a decision is surgery warranted or not. So
Sure. And it sounds pretty self-explanatory, but can you explain what a person is looking for when they have a tongue or lip tie?
A lip tie would be when you lift up on the upper lip, there is a small piece of fascia kind of right in between the two front teeth, or where they would be, or on an infant just inserting onto the gum pad. And so one thing that we always look for is when elevating the top lip, if you notice any blanching on the gums, then that might be an indication that that tie is too tight for that infant. As for the tongue restriction, for an adult or anybody who's able to follow commands, being able to open as wide as you can and raise the tongue to your top teeth, and checking for that tight restriction underneath. And so some of them aren't always as obvious. Some of them are more of like a posterior tie. And so some of them you don't notice until you put it under tension. And so I think that's the most important thing, is making sure that you get it assessed by somebody who's familiar with viewing these posterior ties, because a lot of them go undiagnosed, and in infants that could be harmful to the relationship with nursing with mom. And so it's just super important to get it taken a look at by somebody who's familiar looking at those ties.
And what kind of procedure are we talking when we're getting those released?
In our office, we use a CO2 laser, and we put a little bit of numbing gel on there, and then we just would release it underneath the tongue and follow the fascia up on the underside of the tongue, and just to make sure we have no further restrictions, and then they can elevate their tongue on the floor, the mouth stays down. Same way on the lip, we just go up, release it with the laser, and make sure the lip is completely free of movement. We also check for little ties on the sides and down here, so we have complete, free, unrestricted movement of the lip against the gums.
Sure. And is it better to get it done sooner rather than later? Is it more successful when you work on a baby maybe compared to an adult?
For sure.
Let's talk about that.
Mm-hmm.
Yeah, and especially getting it released as soon as possible, because as soon as the tongue can rest in the roof of the mouth, it's going to help with jaw development. And so if you wait to get a tie released, then you'll kind of end up in a situation like I was myself. And I was an adult starting to have some sleep apnea symptoms, and I just wanted to make sure that I got something taken care of. When you have a vaulted palate, it's because the tongue can't rest in the roof of the mouth, and so that's something that can happen. Also,
well, I think just the having the tongue anchored in the floor of the mouth many times doesn't allow proper swallow.
Yeah.
So we want to vacuum seal swallow. We want the tongue to go to the roof of the mouth, seal, and then as the tongue goes back and swallows, creates negative pressure in the throat. And that's what helps drain the eustachian tubes. So when we have that pressure in the roof of the mouth, we're getting all this mid-face development. So we want the jaws wider down and forward with a nice big arch length to fit all the teeth in. And actually the teeth are all secondary. This is all foundational things that if the foundation's correct and the lips and the tongue and the musculature is all balanced, the teeth are going to come in and be just fine. So the teeth are just like little red flags for us at this point, going, hey, something's wrong, teeth are crowded, undersized jaws, teeth have space, it's likely we're probably all right. But the proper swallow at the infant stage is super important, because that's what drives mid-face development. You have kids that come in, I had 5 strep infections this year, and I get my tonsils out. Well, many times it can be a tongue restriction that was undiagnosed. You get that release, they start swallowing properly, drain the eustachian tubes, and they start nasal breathing. Now then the air is getting filtered through the nose and not landing directly on the tonsils with inflamed tonsils and causing all these problems.
Yeah,
So.
and even in adults, you can see orthodontic relapse. So, you pay a lot of money to get your kids' teeth straightened. And if the muscles of the face and the tongue aren't working properly together, you can actually have relapse. And so, that perfectly straight smile that you once had, the teeth are now shifting and moving, and then you might have to go through a second round of orthodontics. And so it's kind of our goal to, help younger children so that way they don't have to go through that as an adult.
Sure. So it's not always about wearing that retainer.
Yep.
It might be other
There's
reasons.
other
Well, it's anything that happens is a direct result of soft tissue dysfunction. There's a tie. There's some imbalance in the muscles between the lips and the tongue, and that's where the myofunctional therapists come in. And so we've got a couple of myofunctional therapists in our office. It's really gaining momentum now, and so they are like physical therapists for the mouth, and they make sure that the tongue is strengthened and that we have the proper swallow, make sure the cheeks are relaxed, lips are relaxed, and so we're not having that undue outside pressure that restricts that, and the tongue's strong enough to push everything out wider, down and forward, so there's plenty of room for the tongue to get up out of the airway.
Sure. And speaking of relapse, is there a chance that once you release the tie that can grow back? So what do you do at that point?
Yeah.
Okay.
Usually after we do a tongue or a lip restriction, we recommend stretches afterwards. Now, if the patient is a little bit older, then we recommend that they do myofunctional therapy. So like he said, myofunctional therapy is just exercises that you do for the face and the muscles of the tongue. So by following up with those exercises afterwards, then you're able to, prevent those restrictions from growing back by just getting everything to work in unison.
Yeah.
Absolutely. Wonderful. We might come back to that a little bit later, but let's talk about sedation dentistry. That's something that you offer in your practice. What is it, and who might be a good candidate?
Well, sedation dentistry in our office is done by my wife, who's a CRNA, and we actually do TIVA sedation, so it's total intravenous sedation. So we come in on kids. We'll give them a little shot in the arm, get them to sleep, start the IV, but they are asleep and they will remember nothing from it. And that allows us to do what we need to do on kids that are maybe apprehensive about coming to the dentist. And so we can get everything done and at one time usually, and they don't remember anything. They don't have a traumatic experience. And then if it's a referral from another office, we send them back to that office. If it's one of our patients, then of course they stay in our practice. And then we try to get them to the point where they don't need that. We want to sedate them once, get the work done, and then I hope I never see them in sedation again, but we want to see them on hygiene and make sure they're getting their teeth clean, and we've corrected all those habits that needed corrected. But with adults, it's pretty much the same way. I mean, you start an IV and you're not going to remember anything. We have control of your airway, but we have an anesthesia machine there and all the crash cart and all the drugs and everything else you'd have at a surgery center. And so, safety is number one. And so the people that I know you ask about, some people who's a candidate, who's not. So we're not allowed to intubate patients in Kansas in the office unless it's an emergency situation. So knock on wood, we've never had to do that in over 10 years, which is how long we've been doing it, by the way. We didn't have to do it 10 years ago. And but we've never had to do that. And so larger patients that may have a lot of weight in their neck, super large tonsils that are touching, things like that. Anything that's a risk for potential intubation once they go off to sleep, we're going to refer those to the hospital and have their dentistry taken care of there. So by and large, we can handle most people that need that. So.
Yeah, we always have everybody in for a consultation before their procedure, answer any questions, and then just further evaluate their airways. So that way we make sure that we only select candidates who would be good for a safe sedation in our office.
Absolutely. Earlier you had spoke about teeth being overcrowded. What causes baby teeth to be crowded, and should a parent be concerned?
A lot of times with crowding, it's just due to like a mid-face development issue. And so it all kind of goes hand in hand. So when the tongue isn't resting up in the roof of the mouth, the top jaw doesn't grow the way that it needs to, which just causes all the baby teeth to touch and not have any room for those permanent teeth to come through. And so kind of goes hand in hand. When you have a vaulted palate, the roof of the mouth is the floor of the nose. And so when you expand that out, sometimes you can have improved nasal breathing. But yeah, it all just kind of goes hand in hand.
Absolutely. Let's talk about teeth grinding and what causes teeth grinding.
Well, there's a couple different things. There's bruxism. So true bruxism is the uncontrollable grinding of your teeth. It's a neurological issue. And so it's, you can only just wear a night guard and just control the effects of it. Nobody really has a way to cure it, if you will. But bruxism in kids, for instance, or teeth grinding in children is, and even in some adults, and a sleep test will vet that out on which direction it is, but many times it's just due to they're trying to reposition their mandible to get their airway open. And so it starts, the brain says, hey, I need more oxygen. Then we start moving our jaw, grinding our teeth, trying to get that airway open. And if that doesn't work, then the next thing you know, the mouth comes open and the tongue drops down. And now we have to breathe out of our mouth. And so, but teeth grinding is an early sign of, hey, I'm having some troubles breathing in many cases. But, you know, many times the sleep study is warranted to figure out what direction are we going. Is it true bruxism, or is it just an apneic issue that we can solve, you know?
Yeah, in our office we do a lot of different guides for children who are suffering with, grinding their teeth at night. And so sometimes just by giving them additional tongue space, we're able to open that airway enough so that way they can stop that habit.
Mm-hmm.
Absolutely. Great information. Now, is it normal for a child to snore?
No.
Sure. So let's talk about that. And even adults, like what needs to be done?
Oftentimes, when a patient isn't able to breathe through their nose properly, that's when, that can be one of the causes of snoring. Another cause of snoring can be, the tongue not having the space it needs in the roof of the mouth, so it falls back and obstructs the airway. And so anytime that somebody is snoring, it's just kind of like a cry for help. We want to make sure it's, sometimes it is cute to see it in kids, but it's not. We want to make sure that they're healthy, that they're breathing properly, and that's just a big indicator that we've got to do something about it.
Mm-hmm.
Absolutely. We'll talk about that more in a little bit, but right now we have a caller waiting to ask a question.
Sure.
We've got Mary on the line from Hayes. Hi, Mary. Go ahead with your question for our dentist tonight.
Hello. I'm curious if the tongue tie can affect kids' speech.
Yeah, most definitely. Tongue ties affect three main areas: feeding, speech, and sleep. And so there's many different indicators in each one of those categories, but definitely it can affect speech. And we see many kids that are in speech, and sometimes we work with the SLPs in the schools, and sometimes we do a release, and then that helps them with their speech. And so yes, we work back and forth, and it definitely can affect their speech for sure.
So is there a point when maybe a parent has their child in speech therapy and it does not seem to be improving? Is there a chance that child just physically cannot pronounce certain words?
Yeah.
For sure.
Okay, so what would you say to that parent?
I would say it's important to get it evaluated by somebody who takes a look at this every single day. Some kids are able to overcome their tongue restrictions and kind of figure out how to move their tongue to be able to pronounce those words. But some kids, it's just the restriction is too tight and it really needs revised before they're going to see any further symptoms or improvement in speech.
Yeah, and I think myofunctional therapy is also a great option. There, prior to surgery, you can always try to stretch things, strengthen the tongue, find out where the deficiencies are, and work on those. And if it can be done that way, well, that's much better than, having surgery for it. So.
Absolutely. And is there a point that, a parent might wait too long and then it's too late, or they can always overcome something?
I think you always can overcome it. Mm-hmm.
I think, because we release adults, but the real problem is the lasting issues with the craniofacial development. They end up with a high arch palate. Many times they've got a lot of allergy problems. They can't breathe through their nose. They're not sleeping good. And that's the result of letting it go too long. Yeah. And then not only do you have to release the restriction and things, but now we've got to fix all of this if they want a better life, So
Absolutely. Good to know. And why is nasal breathing so important? Somebody might think I should just breathe with my mouth. Why is that so important?
Nasal breathing is the only way that you get nitric oxide to your body. And so nitric oxide acts as a vasodilator, so it actually brings more blood flow to your body, your muscles, your brain. And so when you don't get that nitric oxide to your body, then your body is automatically placed in this state of fight or flight. And so that's when a lot of kids may wet the bed, for a longer time, just because they're open mouth breathing at night. Their body's never getting into that rest and digest, that parasympathetic nervous system. And so when that sympathetic nervous system takes over, those are just some of the things that can happen. And so also it gets your tongue into the roof of your mouth, and again helps with mid-face development.
Yeah,
absolutely.
And that's just aside from the basic, the filtering of the air, the warming of the air. Basically your nose is a preconditioner for all of that. And the nitric oxide is also fungicidal, virucidal, bactericidal. So it's killing a lot of bugs before it ever gets on that tonsillar tissue. So people that breathe through the nose don't have these big swollen tonsils, big swollen adenoids near as much as people do that breathe through their mouth.
And we've even seen a lot of children who, once they start nasal breathing, once they get an appliance that helps them stay closed, parents might have been considering getting their child's tonsils removed. And then after just, chronic nasal breathing, their tonsillar tissue has shrunk down. And even if a child has had their tonsils removed, over time that tonsillar tissue can grow back. And so it's just important to keep that nasal breathing, keep the tonsillar tissue down so it doesn't continue to be an issue.
Absolutely. We have just a little bit of time left. I'd like to hit about cosmetic services that your practice provides.
Okay. Well, we do whatever anybody wants. we do everything from veneers to implants to smile makeovers, if you will, full mouth reconstructions. So if somebody comes in that's neglected their mouth for many, many years, and they're just like, I really want a set of teeth that I can chew with, be confident with. I can go out in public and speak. I can go out in public and eat. That stay in all the time. We do that, but there's also people that just want a regular set of dentures. We do that too, and so I wouldn't call them cosmetic dentures necessarily, but they're very, very nice and indistinguishable from natural teeth. Just don't have the performance of a prosthetic that's in the bone with implants. So.
And we also do offer Botox filler and whitening treatments as well. Both Paul, myself, and his wife Steph have all been certified with the AAFE, and so they actually have taught us all the techniques for both trigger point injections, so people who have chronic migraines, TMJ pain, we're able to do Botox to help with that, but we also do provide full cosmetic services for that as well.
Yeah.
Absolutely. I was going to ask what are dermal fillers?
Yes.
Let's talk about it.
Yeah, so if somebody is missing a little bit of volume in certain areas of their face, especially with being in dentistry, we focus a lot on the mouth, the lower third of the face, and so we can fill in those areas. We can help the lips have a little bit more fullness to them. If somebody has a what we call a gummy smile, so when you smile, you show a little bit more gum than you're comfortable with. There's different injections. I guess that's more Botox, but we can do that to lower the lip. But yeah, other than that, dermal fillers is mainly just giving you back volume in areas that you've lost it over time.
Wonderful. And what is Airway Focused Invisalign?
Airway Focused Invisalign is just basically doing expansion, but we're doing it with the clear trays. And so, again, we're using the teeth to stimulate the bone to move out so that we have a lot bigger area for the tongue to get into. So if you show up and you've got, say you're trying to put a 12-foot tiger in a 6-foot cage, we want to expand that cage so you can put the whole tiger in there and it's not falling back in your airway. And so we just happen to use clear aligners to do it in some cases. We also use bracket and wires in some cases, and in some cases we actually screw an appliance into the roof of the mouth and actually split the palate that way to make it wide enough to accommodate everything. So.
Wonderful. Well,
Yeah.
we covered a lot tonight. So
Yeah.
we want to
We
thank
did.
Dr. Paul Jones and Dr. Courtney Kaba from Cedar Lodge Dental Group in Hayes for being our guests tonight. Thank you for joining us and for your continued viewership on Doctors on Call. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.